Hello there. In this video, I just wanted to quickly talk to you around reflux and weight loss injections. So, as I've said in previous videos, this is not to scaremonger. I'm not anti-weight loss injections. I'm all about patient awareness and patient education and enabling people to manage the side effects of their weight loss injections. So we know that weight loss injections delay the gastric emptying process. So food should normally stay in the stomach for 2-3 hours maximum, and then move further through the digestive system to be further broken down. With the weight loss injections, we know that that stays there for a lot longer. And when food stays in the stomach for a long time, it generates hydrogen sulfur gas, which is why patients often have sulfur burps with weight loss injections. But that production of gas increases the pressure on the muscle that sits at the top of the stomach. So when we swallow food, food goes down through the esophagus. At the base of the esophagus, where it enters the stomach, is a muscle called the lower esophageal sphincter. And that band of muscle should open to allow food to enter, and then should immediately close and remain closed to hold the food in and reduce the risk of food coming back. And what we know is that that sphincter can be damaged, or it can actually be affected by certain factors. So if it's damaged, so if you've got a hiatus hernia, then that sphincter doesn't function properly, and it's more likely that you're going to have reflux. So if you already have a hiatus hernia and you're taking a weight loss injection, then your risk of reflux is going to increase due to the impact that that's having on that band of muscle. But alongside having a physical problem, we have other things that cause that muscle to relax and open the gap a little bit more. So holding food in the stomach, having that hydrogen sulfide gas that's produced when food stays in the stomach for too long increases that risk of reflux. Then there are certain foods that also increase the risk of reflux. Things like tomato, citrus, chocolate, peppermint, alcohol. All of those foods make the muscle more relaxed, make it much easier for the stomach contents to come up and cause a problem. So what can you do about it? So the first thing is to really make sure that you're chewing your food properly, so that it's broken down, so that it's partly digested, to reduce the time at which the food stays stuck in the stomach. It's also important to have maybe smaller meals more often, and also making sure that you're not eating too close to bed. So trying to make sure that you've got at least a 3-hour gap between your evening meal and bed is ideal. Using weight loss injections probably needs to be a little bit longer, but that might not be practical. But if you can aim for that 3 hours, then that's really, really important. We also need to make sure that wherever possible, we raise the head of the bed, especially if you're getting reflux overnight. And sleeping on your left-hand side can be quite helpful as well. One of my key recommendations is the use of Gaviscon. So Gaviscon is a product that's made from alginate, which comes from seaweed. And what happens is Gaviscon mixes with the stomach contents, and it forms like a plasticky raft. So it sits on top of the stomach contents, so that when those contents bubble up and that sphincter relaxes, what the Gaviscon does is it forms a plug at the top of the stomach, and that can reduce the risk of stomach contents coming up and causing heartburn. And that's really, really important, because if you get stomach contents coming in contact with the esophagus, it can cause erosion, it can cause esophagitis. And if that happens for a long period of time, it can also cause something called Barrett's esophagus, which is where there's quite a lot of scar tissue. And that can be quite a serious condition in and of itself. So making sure that you have a dose of Gaviscon before bed can protect your esophagus overnight. If you have heartburn after every meal, then take Gaviscon at the end of the meal. If you know that you're eating foods that trigger your reflux, then make sure that when you have those foods, you follow them with a dose of Gaviscon. And by the way, guys, I am not sponsored by Gaviscon. There are other products that you can get, Peptac, Acidex, but you want an alginate one. That's really, really important because it's only the alginate ones that plug the top of the stomach. So for me, that's a really important tool in your toolkit. And if it's always better to preempt the heartburn than it is to have the heartburn and then react with the Gaviscon. So if you know you're having the heartburn all the time, then take the Gaviscon all the time, especially because we know it's the weight loss injection that's causing some of the problem. Once you've had that reflux, the Gaviscon's not going to do anything then because it's already come in contact with the esophagus. So it's almost too late. So if you're having regular heartburn, then you need to be regularly taking the Gaviscon. If you haven't seen your GP and discussed it with him, then it's really important that you do. Whilst we know that weight loss injections increase the risk of reflux, we do also need to make sure that there isn't something else underlying causing a problem. So if you haven't mentioned it to your GP, then please do. But it's really, really important that you manage that reflux. Now, sometimes what the GP might well do is prescribe you a PPI, or proton pump inhibitor, so omeprazole or lansoprazole. And whilst that helps to reduce the stomach acid, that can actually cause more issues from a digestive perspective because it's increasing the risk that you're going to get something called gastroparesis, which is something that can happen long term with weight loss injections. So gastroparesis is the delayed movement of food through the digestive system. So it's important that we manage the acidity first. So if a PPI is appropriate, then that is fine. But actually using the Gaviscon, chewing your food, having smaller meals, all of that is super important too, because we do need some stomach acid to help with the digestive process. So it's a case of managing that however we can. And another thing to be aware of is that a key cause of reflux is gallbladder issues and gallbladder sludge. So if you haven't checked out my gallbladder videos, then do make sure that you have a look at those, because there's a lot more information in there from a gallbladder side of things. If you have got reflux, whether you're on a weight loss injection or you're contemplating a weight loss injection, or you're just here because you've got reflux and you want some more support, then please do check out my website, Digestion with Confidence, where you'll find all my lovely practitioners who've been trained to support patients with reflux and gallbladder issues. And if you've got any questions, please feel free to pop them in the comments and I'll pick them up whenever I can. If you've enjoyed this video and you're not subscribed, please do consider subscribing to my channel so that you can be kept up to date. And do make sure you give me a like if you've liked this video as well. I'll be covering lots more going forwards, and hopefully I'll see you in another video. Thank you for watching.